Zombies. Zombies are everywhere. It is my duty to inform you of the imminent demise of the human What? What's that? What do you mean that's not this video? Oh, we're talking about those kind of infections. Oh, okay then. Never mind. Just pretend you didn't hear that first part. During the course of a workday, you come into contact with all sorts of people. Not all of them will be 100% healthy. Some of them may be Some of them may just be a little sick. Fortunately, there are things you can do to protect yourself and others from infectious diseases. The purpose of this training is to help you to understand the various precautions you can take to prevent disease transmission. By the end of this training, you will be able to demonstrate effective and consistent precautions that you can take to protect yourself and others from disease and infection. To better protect yourself, it helps to know a bit about what you're protecting yourself from. So how do infections spread? Oftentimes, the infection, or agent, will get nice and comfy in a person, the reservoir, and live there. And when a person sneezes, coughs, bleeds, or does anything else along those lines, they create a way for the disease to make an exit and spread to others. This spread is called transmission. That sneeze or cough is considered to be the mode of transmission. In order for transmission to work, there has to be someone, a host, on the other end that does something to get that disease into their body. This may happen because a person eats something before washing their hands, accidentally pokes themselves with a needle that stuck a person with an infection, or simply rub their eyes with a sleeve that's been exposed to an infectious material. This kind of thing happens all of the time, and often, an infected person doesn't even know what they did to expose themselves to an infectious agent. Many people won't even know they are sick until the infection has spread to the point that symptoms appear. By that time, they may have infected others, just like zombies. Interesting. So how do you protect yourself? No, not that. Wrong type of infection. Wrong type of infection. You practice what are called standard precautions. Standard precautions are methods of infection control practiced in healthcare that uses safe work practices, engineering controls, and personal protective equipment, or PPE, to reduce the risk of infection. Some examples of standard precautions include work practices such as hand washing, no recapping of used needles, and not eating in areas with a risk of transmission. Examples of engineering controls may be safety devices on sharp medical instruments and sharps containers. Hand washing facilities would also fall into this category. Personal protective equipment is anything that may cover or shield your clothing, skin, nose, mouth, and eyes. These may be gowns, gloves, goggles, and masks. Some good rules of thumb around standard precautions include considering all people to be potentially infectious. Friends, family, strangers, even the nice guy at the supermarket. All of them have the potential to get you sick. All of them. Even if a person doesn't look or act sick, they may still be carrying an infectious agent. Even the nice guy at the supermarket. Be careful. Be especially careful around blood, all bodily fluids, secretions, excretions except for sweat, mucous membranes, and non-intact skin. And again, this is a good example of what a person looks like when they are wearing PPE. Notice the gloves, gown, goggles, and mask. Now let's talk about hand hygiene. Sinks, soap, and paper towels are all available at the nurse's station. Gel hand sanitizer can be found in hallways, doctor's offices, and the nurse's station as well. Always wash your hands before and after client contact, after removing gloves and other PPE, and after contact with contaminated surfaces, items, and specimens, even when gloves are worn. Definitely wash your hands before eating or drinking, after using the restroom, and after coughing, sneezing, or blowing your nose. The CDC recommends washing your hands with soap and warm water using friction for at least 15 seconds. The use of a gel-based hand sanitizer is the preferred method of hand hygiene in healthcare settings unless visible contamination is noted. And also remember, when you cough and sneeze, use a tissue to cover your mouth and nose and then throw that tissue away. Don't keep it in your pocket or push it down between the couch cushions. Just throw it away. And then wash your hands, of course. Now that we've talked about taking care of yourself, how do we take care of infectious waste? If you have used needles or other pokey things, they go in the sharps containers. Sharps containers are bright red, leak-proof, and puncture-resistant. They also come emblazoned with the biohazard symbol, which reminds me of the topic I originally thought this video was about. But anyway, put needles, syringes, and other pokey things in the sharps container, and don't overfill it. Next up are the biohazard bags. Like their less flexible counterparts, they are also bright red. They also have the biohazard symbol, so you don't mistake them for your Chinese takeout leftovers. These bags are for disposable items with blood or other bodily fluids that are pourable, drippable, or squeezable, kind of like the tissue you just hid between the couch cushions. These 2 containers are for your safety. Use them properly and they will help protect you. Another thing that was created to protect you was the Needle Stick Safety and Prevention Act. Since the dawn of man, people have been getting poked and jabbed by needles. But finally, in the year 2000, OSHA decided enough was enough. This law mandates the use of needle safety devices and work practice safety controls. The reason all of this is a big deal is because needle sticks are a very common way to be exposed to bloodborne pathogens. Other common scenarios to watch out for include coming into contact with a person's blood or bodily fluids. Sometimes you won't be expecting to deal with this stuff and you'll not have your PPE on. This is the perfect time for diseases to transmit, so stay on your toes. Use your PPE and dispose of all of the nasty stuff in the proper way. So what is it that we're trying to protect you from? Namely, HIV, hepatitis B and C, and No, never mind. Let's forget that I said that and take a second to talk about HIV. The human immunodeficiency virus can lead to AIDS, acquired immunodeficiency syndrome. The virus attacks the immune system, and though it acts like a bully inside of your body, it is a total weakling in the outside world. Symptoms include fever, loss of appetite, weight loss, chronic fatigue, and night sweats. Unlike HIV, hepatitis B has no problems living outside the body. It's carried in blood and bodily fluids and can present itself with all sorts of icky symptoms like fatigue, loss of appetite, nausea, abdominal pain, vomiting, and jaundice. Hep B is not messing around and can cause acute chronic health problems. Hep B's cousin, hepatitis C, is also not a very nice character. It's similar to hepatitis B and can also cause chronic liver disease later in life. Hep C is sneaky, and symptoms of it may not appear for years. The most common way to be exposed to hepatitis C is through needle sticks and the sharing of needles. It can be contracted through sexual contact, but this is less common. And another thing to keep in mind is that there is no vaccine against hepatitis C, so once you have it, you have it. Up to this point, we've focused a lot on blood and needle sticks, but those are not the only way to get infectious diseases. Diseases can travel between people using any of the following methods: contact, droplet, airborne, common vehicle, and vector-borne. Contact transmission can happen in 2 different ways: direct transmission, which means person-to-person contact, and indirect transmission, which is when someone sick contaminates an object and then it gets touched and the disease passes to the next person. If zombies were real, and they aren't, but if they were, zombies would use direct transmission because they like to bite, if they were real. Other illnesses that are commonly spread through contact include staph infections, norovirus, rotavirus, and hepatitis A. Hepatitis A is spread through contact with contaminated feces or direct exposure with an infected person. Symptoms occur around 4 weeks after exposure and can last up to 2 months. Fortunately, a vaccine is available for hepatitis A. Droplet transmission occurs when large particles of droplets of 5 microns or more come in contact with mucous membranes like your eyes, nose, or mouth. Where do these droplets come from? Someone coughing, sneezing, or even talking to you, or when you're performing a procedure such as a bronchoscopy or suctioning. So let's pretend you're talking to the nice guy at the supermarket. And as it turns out, he isn't feeling great, but he's awesome, so he isn't going to let a little bit of a flu get him down. And just as you're wrapping up your conversation, he gets a sneak attack sneezing fit that ambushes him before he has time to cover his mouth. A fine misting of saliva and mucus rain down upon you, and that nice guy at the supermarket is so nice, he just gave you his flu. He may have also given you pertussis, mumps, adenovirus, or SARS, since those are transmitted in this fashion as well. Airborne transmission is similar to droplet transmission, only the droplets are much smaller. Less than 5 microns in size, actually. These droplets are so small, they can be carried as far as 25 feet on particles of dust that are floating in the air. Diseases that are spread this way include TB, measles, and varicella. Some diseases can be airborne or spread via contact, and those examples include SARS, monkeypox, smallpox, and disseminated shingles. We're telling you about all of these transmission types because there are ways to protect yourself and others from each one. Contact-based disease transmission can be thwarted by the physical separation of infectious people from healthy people, meaning if you're sick, don't come to work, and if a child is sick, don't send them to school or daycare. In In general, sick people should not be in social settings. When possible, they should be confined to private rooms or areas, and any equipment or surfaces they touch should be disinfected. Staff must always remember to wash their hands and also ensure that the infectious person is washing their hands as well. And use your PPE to protect yourself. Wearing your PPE also defends against droplet transmission. Other ways to protect yourself from droplet transmission is physically separating infectious people from healthy people and giving them private rooms or areas. And if you must be in contact with an infectious person, try to stay at least 3 feet away from them. If a person has an infectious disease that is spread through airborne transmission, move them to a negative pressure hospital room, and when coming into contact with them, make sure you are using an N95 protective mask or positive pressure hood. When transporting an infectious patient, apply a standard surgical mask to them as well. Make sure they keep wearing that mask until they are in a negative pressure room. And there will be times when wearing PPE is inconvenient, but remember, we wear this, so we don't end up wearing this. Stay safe out there, use common sense and these standard precautions, and you'll be protecting not only yourself, but those around you.